Thanks, Premier. Certainly 428 cases, new cases, is both disappointing and concerning. We have not turned the corner here. Worse than that, 428 cases does not just represent that we've got increasing numbers day on day. There will be dozens of individuals who will require hospitalisation out of these 428 people. Tragically, there will be several who will require intensive care support, and a number of people will die. And whenever we have a day with these numbers, that is the case. So it has to turn around. I have talked for some days about a hope that numbers stabilise, but also said there is no guarantee about that. It does reflect behaviours and mobility from 10 or more days ago. And so, of course, there's a hope that these numbers stabilise in the coming days towards the end of this week. That's my hope, but no one is being complacent here, and we are all thinking about the additional measures that might be required if it doesn't turn around. We are not just banking on the idea that if we wait long enough, that number will stabilise and go down. So we have to bear in mind any additional measures that are important to help control the numbers. There are a number of outbreaks that are ongoing. New cases linked to those outbreaks are partly responsible for driving up the numbers. When you've got so many outbreaks that help amplify transmission, they obviously contribute to the increase in numbers. A few updates: 160 cases now linked to Al Taqwa College, 51 cases to Somerville Retail Services in Tottenham, 38 cases at Menarok in Essendon, 36 cases at Estia in Ardea, 32 cases to JBS Abattoir in Brooklyn. There's also some stabilisation in other settings. 19 cases in Northern Hospital, no change since yesterday. 16 cases at Brunswick Private Hospital, no change since yesterday. And the 23 cases at Glendale Aged Care in Werribee hasn't changed since yesterday. But there are new aged care facilities with cases reported. That includes Aurum Aged Care in Plenty, and then single cases linked to Regis in Brighton, Grace Villa in Greensborough, Bapt Care Wyndham Lodge in Werribee, and Bupa Aged Care in Sunshine. As I said, these numbers represent a daily tragedy. There have been 3 new cases since yesterday, and with over 400 cases today, we know that that will represent people who become very unwell, some people, of course, with mild illness, but a number of people who become unwell and actually have chronic symptoms after that. Recent evidence suggests that people have symptoms for weeks, 2 months after recovering. So this is not even an illness where you get over it after a couple of weeks and you get back to a normal state of health. For many, many people, this represents a disability that they carry with their breathing or with their general health for some time to come. And we are not far enough into this pandemic to know what the long-term consequences might be. And there may well be people who really carry this disability or this chronic condition for years to come. I hope that is not the case, but it is obviously concerning that people who've required hospitalisation, people who have severe illness, really do not recover for some weeks afterwards.
Is it time to stop all visitors to aged care centres and to actually ban mandated staff can't work recesses?
What we've seen from the aged care outbreaks is that it's really staff who are becoming unwell and inadvertently bringing virus into those aged care facilities. Visitors are checked very closely. There's been a significant limitation on visitors, but we're not seeing that visitors have introduced it into those facilities. There is an important element to the health of residents in seeing their loved ones and their carers. Some individuals will die when they don't see their loved ones and carers, and so there's a balance to be struck there. But I know that a lot of aged care facilities have really significantly reduced visitation. I don't think it should be a ban. I think it needs to be considered on a case-by-case basis.
Well, any of today's gets linked to those aged care facilities, I guess? with those clusters, are you now reporting?
There's one individual who's linked to an aged care facility from today's deaths, yes.
Can you talk to
Menarok.
So what's the total number of deaths now in Menarok?
I don't know, sorry.
So sorry, is that how many cases, all three of those cases, deaths linked to Menarok?
No, just one.
Just one, sorry. And just further to that, you talked about the reproduction rate yesterday. Do you have that? What's the current reproduction rate?
Look, there are different methods in calculating the effective reproduction number. It's very close to one, if not below one. It kind of we get a range. So there's a probability that it's below one. There's a probability that it's above one. It seems to be sitting at one from the modelling that's been done. That's reassuring. But we also have to go on the numbers we see every day. We also have to take that precautionary principle and work on the basis that we can't just sit back and expect numbers to go down because modelling tells us so. We have to accept that all models are imperfect. They've been very good at predicting the numbers week by week in Victoria to date. But we have to accept that if we see ongoing numbers, even if the modelling is telling us it should go down, we have to respond to the reality on the ground.
So when we're seeing such big numbers day by day by day, even if we don't kick over to the stage 4 restrictions, do you think it's now increasingly likely the 6-week lockdown is going to become longer than that?
It's really hard to say how long a lockdown might be required. If people are really following the restrictions and doing the key things that we're asking of them, we've seen these numbers drive down very quickly. Through the first wave, the effective reproduction number got to 0.5, and so really cases were halving every cycle, every generation. We can do that if people are really universally following the directions.
They're clearly not though, are they? I mean,
Well,
we were hoping we would see improvements by now.
It is early days, and we can still see as numbers decrease, our ability to find individuals and to follow their close contacts gets greater and greater, and we can reduce those numbers on the downside much faster because it becomes more in our control when the numbers are less. But it has been a slower process.
Sorry, you said you'd started thinking about the additional measures that might be required if we don't see a turnaround. Are you able to talk us through what your thinking is there and I guess what the threshold is that you're going to reach where you decide those additional measures are required?
Everything's on the table. There are lots and lots of measures that we need to bear in mind, and we shouldn't discount anything. We do need to follow the epidemiology and understand where transmission is occurring. We know that essential work is driving some of it with our outbreaks in aged care and in healthcare, and so there's absolutely a focus on PPE and awareness of symptoms in aged care and healthcare workers, and universal mask wearing is something we're absolutely advocating for in this space, but also the screening, the symptom awareness for everyone so that they are getting tested and isolating very early on. There might be other workplaces that we need to look at. There might be increased compliance measures that we need to look at, but we're not there yet in terms of defining and understanding exactly what might be required or if it's required yet.
Those hospitalisation numbers keep rising and rising. What measures have been put in place for those doctors who are on the front line? Are they being put in alternative accommodation so they don't take the virus home? And not just doctors, but all healthcare workers. Is there enough capacity in that sort of protecting them?
Yeah, I might get a minute to speak to the Hospital for Heroes program.
You talk about lockdowns only being in place for eight days. You talk about not enough time yet, but when is enough time to actually see something? People, every day when numbers come out to the public that lock us down, scared, when is the time frame?
Certainly, we have an expectation that the things that we've put in place 2 weeks earlier should show up in the numbers. So when that 2-week period is completed, we would expect that to manifest in the numbers. So at the end of this week, we're getting very close to that. I think it's still a consideration every day, and we wouldn't wait for a 2-week period if we see concerning elements in any of the postcodes, any of the local government areas, or any of the kind of transmission networks that we're reviewing every day. So 2 weeks is a simple answer. but it's not to say that we would wait that long before making a decision.
Most hotspot postcodes are now being locked down though for 2 weeks. Has the behaviour moderated? Have the cases in those hotspots moderated? It doesn't appear that it has.
They have and they haven't. So the mobility data suggests that it's changed very significantly across Metro Melbourne, including in the hotspot areas. So it's not as if that hasn't shifted. I've seen very significant shifts in the data for mobility in terms of the amount of time people are spending at home, how much traffic there is on the roads, and the general movement of people from Facebook and Google data that's publicly available. That said, not all postcodes have stabilised. We've seen some postcodes within the initial areas that have plateaued to some degree, but there are other postcodes within those same local government areas that continue to take off, and so it's not a uniform picture, and it might be that some of those other postcodes are yet to plateau, but it might be that they're not moving in that direction. And so again, we have to bear in mind that there's a precautionary principle to take. We wouldn't wait to see if that change occurs. We need to see what it's looking like on a daily basis.
So, Premier, on that point, would you consider tougher, more policing of those areas?
Nice town before the Sunday release.
Yeah, I haven't got the exact number here today, but the Alfred Street Tower obviously went through that 11-day quarantine testing program. So I think there are 20 additional cases that have been identified through that. Again, not entirely unexpected amongst the hundreds who've been tested. Yeah, so that have come through in recent days to bring the number to around 70. So that's it's a big number in the scheme of things. But again, I think it's been people having been exposed in the quarantine period that have turned up as positive as we've gone through that day 11 testing for everyone in quarantine.
Can I just ask on genomic sequencing, obviously you released the first lot of data and you're not releasing the second or the most recent lot. Who's made that decision not to release that?
So there hasn't been a release of data at all. I shared it with the Premier and the Premier spoke to it in terms of the announcement of the judicial inquiry.
You did say yesterday you wouldn't be releasing. You made the decision not to release it because of the inquiry that's coming up. Who's made that decision?
So I think I clarified yesterday, it's not my data. I haven't produced it, and it belongs to Peter Doherty Institute, who's generated it.
Unfortunately, they're saying they can't release the data because it's been covered by the inquiries.
Yeah, their judgment, and I think it's not an unfair one, understanding that the inquiry is about to kick off and that it'll all be looked into very shortly.
We're seeing in New South Wales that people are becoming infectious as soon as the day after they're contracting the virus. Are you seeing that's occurring in Victoria as well? Is that posing a risk, posing challenges for contact tracing?
People can become infectious very shortly after being exposed, right up until the 14-day period. But I think the particular circumstances in New South Wales related to a very infectious individual who passed it on to a number of other people. And because of that infectious dose that they received, they've developed symptoms very quickly. So it really relates to the specifics of that outbreak in New South Wales. We'll have cases like that in Victoria, but it's all within the spectrum of what to expect.
Are you able to tell us how many aged care residents have died in the second wave?
I don't know, sorry, in terms of the total number, but we can get back to you.
Could we get that information?
Just a very
Last
quick-
questions, please.
Yes, just a quick question on New South Wales Premier.
Sure.
There's quite an inflammatory front page.